Ladies and gentlemen, thank you so much for attending. My name is Joshua Manga and I'm going to teach you CPR. So for CPR, to break it down, it is cardiopulmonary resuscitation. So you're bringing the heart back to life using the lungs. It's a very practical, simple thing, but important thing to know because this can happen anywhere. This could happen at the office, at your client's residence. It could also happen at the mall, the bank, anywhere you want to go. So let's say you are taking care of this patient. You were just talking to them, and once you realize their eyes roll back, they're slumped over, you don't know what's going on, first thing you want to do is tap them on the shoulder. Hey, are you okay? You are checking to see if they are actually coherent, if they're actually awake. If you realize there's a problem, the next thing you want to do is lay them flat on the surface. Flat surface like a hard table or a hard floor, preferably. You can pull them down, whether it's their arm, leg, however you can, but as long as you lay them flat, that is what matters. As you lay them flat, the next thing, and one of the most important things, is to call 911. Please don't forget to call 911, or else no one's going to help you. It's going to be an issue. So as you talk to 911, you have the phone on speaker. There's 3 things I want you to tell them. Name, if you know the person's name, location, the indication, so not breathing. So name, location, not breathing. After you have established that, the next thing is to do the actual compressions with CPR. So with the compressions, I'm going to show you on the dummy. Here is the nipple line. Right below the nipple line is where I want you to put your compressions. You would do this fully clothed, but I just want to show you this on a clear example. This is where you want to put your pressure on your palms, interlock your fingers however you feel comfortable, right in the center, place, interlock, keep your elbows straight, your shoulders over your hands, you press down and let the chest rise back to normal. Down, back to normal. So for the first part, you would do 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that 30, you're going to check the pulse. So if this is the center of your pulse, our center of your throat, off center is where you place your fingers. You're going to place your fingers, not your thumb. Your thumb is your own pulse. So you're going to do this preferably on the side that's closest to you. Press and hold. And as you press and hold, it's like you're counting down from New Year's. So you start off with 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. If you do not feel a pulse, you go back, you do another set of 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, you would tilt the head back, lift the chin, and you give 2 breaths. And as you give the breaths, you can look and see the chest rise. Now in reality, this is mouth to mouth. Some people are not comfortable with mouth to mouth, so what I suggest is that you get a face mask, not a face mask like in COVID-19, but a face mask from CVS, Walgreens, Walmart. They can direct you. It'll be a sheet where you can place and hold, and you can give proper breath so you do not contaminate the person or that person does not contaminate you. If you do not have that available, grocery bag, paper bag, plastic bag, poke the hole, cover it, it's perfectly fine. If you don't have that as well and you don't feel comfortable, do not do the breaths. Compressions are more important than the breaths, okay? So in total, it would be 30 of these compressions, 10-second hold, and another 30, 2 breaths. All that is 1 cycle. Now, If you are by yourself, you just keep repeating the cycle over and over until the ambulance comes. That's why it's important to call 911 before you even start this. If that's not the case and there's 2 people with you, then it's 5 cycles. So I would do 5 cycles, then my other partner would do 5 cycles, and then we rotate. Now, once you do this, which I highly suggest you do this in person, you're gonna understand that this is very tedious, it's very hard. So not everybody gets to 5 cycles, just to be honest. So that's why it's very important to count out loud, because after my 30, if I can't get to 30, I'm letting my person know, hey, after 20, I can't do this, we're gonna have to switch. So it's very important to make sure you communicate with your partner. Now this is for an adult. This is a frame of a child. Now I say it's a frame of a child, but this could be grandma, grandpa. It kind of doesn't matter. Just understand, if they are smaller individuals, treat them like a child. I say this because with that, you could break a rib. If you break a rib, it is okay, a doctor can fix that. But if you've done a little too much, then it might be a problem, essentially. So with a child, the difference is that instead of doing your 2 hands, you do 1 hand, 1 wrist. Doesn't matter what wrist, 1 hand, 1 wrist, same place, same number, same everything. 1 hand, 1 wrist. The difference is when you are dealing with an infant, a baby. Some people go trying to figure out the specific number for a baby, but if you can still carry this infant, treat them like an infant. So a scenario is that you're taking care of your patient who has a baby, and as you're taking care of this baby, you don't hear them, you check them in the crib, they're not breathing, they're changing colors. The first thing you want to do is do CPR. So that's one of the big differences between a child and an adult and an infant. You check the baby, still like normal. If they are not responding, that's when you do CPR. You'll do CPR for 2 minutes or 5 cycles, whichever one comes first. And after that, if you realize nothing is going on, that's when you need to call 911. So for a baby, you're gonna do your 2 fingers right here, or you can do your 2 thumbs right here. It doesn't matter, it's whatever you feel comfortable doing. So as a baby is still 30 times like everybody else, but if you are by yourself, no, if you are with somebody, it is 15 instead of 30. So that's another difference between an infant and the rest. So for example's sake, I'll say my partner is off camera, but I would do 15. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. After that 15, I would check the pulse. So you do not check the pulse here on a baby. It is too small. So what you want to do is check between the elbow and the armpit in the bicep area. Right about here, you press and hold. So you're going to press and hold still for 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You don't feel a pulse, you do another 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. After that, you tilt the head, give the 2 breaths, or you can lift the baby up. If you're comfortable, give 2 breaths as well. Now, normally, a baby is in this position because they are choking. Now, that could be anything, really. They can choke on anything, babies get into stuff. So If the baby is awake, one of the things you want to do, if you see the object, take your pinky, go in there and scoop it up. If you see it. If you do not, don't worry about it because you might make it worse. So one of the things you want to do is turn the baby over, face down, tilting down. So you could do this standing, sitting, it doesn't matter, but as long as the baby is pointing down, that's what matters. So the upper back is where you want to hit the baby. You're going to hit the baby, not a love tap, but hit the baby 5 times. So 1, 2, 3, 4, 5. You would tilt the baby over. If you see it, great, scoop it out. If not, go back. 1, 2, 3, 4, 5, back and forth until the object comes out. There is not a set number of times. If you feel comfortable to continue, great. If not, you would turn the baby over to their side. Either side is fine. Flip them over. They're still able to breathe in this position. So after this, hopefully you would call 911. Everything will be all right. But to go into choking, I would start with the adult first. And with this adult, understand this could happen as you're taking care of your patient. This could also happen at a restaurant, at home, where you're talking to this person and they start choking. If they are choking, this means choking. It doesn't matter who you are, where you're from. This means choking. So if that is the case, you would tap them on the shoulder. Hey, are you okay? They're telling you no. What you would do is tell them to stand up in front of you. And as they stand up, you're gonna put your foot in between their 2 feet like this. Now this is called the Heimlich maneuver, what I'm about to show you. You would lean back, and if this is their belly button, you wanna make a fist pointing down, close the thumb above the belly button, cover, go in and up, in and up. That will send a gust of wind and it should come out. If the person is pregnant, you don't want to do it here. What you want to do, if this is the nipple line, this is the collarbone, you would want to place the same pressure just up here. It would still work that way. Now, for a child, you would not want to lift the child up. What you would want to do is crouch down to child level's height and do the same thing, and it should work fine. One of the last couple things I want to tell you is if you're having a heart attack or if a stroke is happening. A heart attack is pressure, a lot of pressure in your chest. So you're gonna feel a lot of pressure in your chest, in your back, you're sweating, you feel nauseous, all these things at the same time. It's possible that you might be having a heart attack. So if that's the case, do not lay on the couch, do not lay on the bed. You want to make sure you are on a solid surface to prep yourself. After that, what you would do is jump up and down and cough. And as you're coughing, you're yelling for help. So somebody help me, somebody help me, somebody help me. That sends a lot of blood and oxygen to your brain so you can save yourself prior to someone saving you. The thing with a heart attack is that there's a lack of supply of blood and oxygen to the brain. So once you pass out, you want to make sure you've supplied yourself so when they do CPR, your brain is fine as well. And the last thing I want to tell you is stroke. So stroke is too much pressure in the brain, and with that, you would see signs in the face, in the arms, possibly in the legs. It's early in the face, it's getting bad in the arm, it's getting really bad if it gets to your legs. And it'll show one side of the body, so you might feel slumped. If someone's drinking water, it'll come out of one side. They're not able to see, not able to talk well. They're not able to move their hands the same direction. These are different signs. So with a stroke, you want to decrease that pressure. With a stroke, there's blood. You can do that with cold and heat. Blood, cold, and heat. You pick one, don't pick all three because they'll cancel each other out. So with blood, let's say this is the affected side. I'll pull, twist, something of that nature to get blood into this area, and I'll prick the ear like an ear's pierce. That is releasing a valve of pressure. You send them to the ER as soon as you find out. They should be okay. Now, if blood is a little too much for you, another option is cold. Cold is something where you can just put an ice bag, put anything that you can find that's cold over the head. Since a stroke is swelling, that's another avenue of just decreasing that pressure. And the last thing is heat. With heat is something to dilate the blood vessels, and that you can do with something spicy. So you eat something, you get them to sweat, you dilate, flushes out the blood vessels, you send them to the ER, they should be okay. But just remember, you pick one, don't pick all three, stick to that, and you should be okay. But I thank you guys for taking your time to learn about CPR, learn about choking, learn about heart attack and stroke, and just be aware of your surroundings because this could happen anywhere, and we just thank you for your time.